What if what we call anxiety is actually your brain stuck in survival mode? The racing heart, the tight chest, the constant feeling that something bad is about to happen, even when nothing is wrong. Most people think this is overthinking, or weakness, or just being too sensitive. But psychology says something very different. Anxiety disorders are not rare. They are actually the most common mental health conditions in the world. And they don't just affect the mind. They affect the body, sleep, relationships, work, and even the smallest daily decisions. But here's the key distinction most people miss. Everyone feels anxiety before an exam, before a job interview, before a big life change. That's normal. Anxiety disorders are different because the fear doesn't turn off. It becomes intense, persistent, and hard to control. It shows up as constant worry about everyday things, sometimes with no clear reason at all, and it doesn't stay in the mind. It moves into the body, difficulty concentrating, restlessness, irritability, stomach discomfort, heart palpitations, sweating, shaking, sleep problems, and sometimes a strong sense that something terrible is about to happen, a feeling of danger, even in safety. Psychology classifies this into different types. Generalized anxiety disorder, or GAD, involves ongoing excessive worry about everyday life. Panic disorder involves sudden panic attacks and fear of having another one. Social anxiety disorder is the intense fear of being judged or embarrassed in social situations. Agoraphobia involves avoiding places where escape feels difficult. Separation anxiety disorder is extreme fear of losing emotional connection to someone important. Specific phobias are intense, irrational fears of specific objects or situations. And selective mutism affects mainly children, where speaking becomes impossible in certain social settings despite normal speech in others. At this point, a question naturally appears. If anxiety can affect everything, thoughts, body, sleep, relationships, even decisions, can it actually be treated? The answer is yes, and not only treated, but treated effectively. One of the strongest evidence-based approaches is cognitive behavioral therapy, or CBT. CBT doesn't try to remove anxiety. It teaches the brain how to respond differently to it. It helps people identify distorted thinking patterns and replace them with more realistic ones. And gradually, it helps people face what they avoid instead of running from it. CBT includes practical strategies like journaling, tracking thoughts, emotions, and triggers; cognitive restructuring, challenging automatic negative thoughts; activity scheduling, reintroducing meaningful daily activities; breaking goals into small steps; mindfulness, bringing attention back to the present moment; skills training, improving communication and social confidence; and controlled breathing techniques to reduce physical symptoms. One of the most powerful CBT methods is exposure therapy. Instead of avoiding fear, you slowly face it in a safe and controlled way. And over time, the brain learns something crucial. This is not dangerous. Exposure can happen in different forms. Real-life exposure, imagined exposure, virtual environments, even controlled exposure to physical sensations like increased heart rate. And with repetition, the anxiety response weakens. Alongside therapy, stress management techniques also play a key role. Relaxation exercises, slow breathing, mindfulness, progressive muscle relaxation, and daily habits matter more than people think. Regular exercise, even walking, consistent sleep, balanced nutrition, reducing alcohol, avoiding drugs that worsen anxiety, and practicing small daily calming routines. For some people, medication may also be considered under medical supervision, such as antidepressants and, in specific cases, benzodiazepines. But the most important point is this: anxiety doesn't just affect emotions, it affects life. But it is also one of the most treatable mental health conditions we know. With the right support, the right tools, and the right treatment, the cycle can be changed.